Hi, it's Steph here. In this short video, I'm going to introduce you to the MINDFUL acronym that you should always use whenever you're reviewing or prescribing antimicrobial therapy for your patients. I hope that by using this acronym, you'll be more mindful whenever you're choosing the antimicrobial agent. The M stands for microbiology. If a culture is indicated based on guidelines or the clinical context, then the culture should always be drawn before the first dose of antimicrobial therapy, if possible. Then we should use the results of these cultures, such as the sensitivity and the bug identified, to tailor and guide your antimicrobial agent selection. The I stands for indication. This is the infection that you're treating. This should be based on the current evidence as well as your local antimicrobial sensitivity data using your antibiogram. N stands for narrow. We should always pick the antimicrobial agent with the narrowest spectrum possible to treat the infection. We can use guidelines to guide the selection of the antimicrobial agent, and even better, if you have culture results with the sensitivity of the organism, then that could be something that can help guide you to narrow down your antimicrobial spectrum. D stands for duration. The duration should also be evidence-based, and we should always pick the minimal duration possible to treat the infection. This is to decrease the side effects as well as decrease selection for antimicrobial resistance when antimicrobial agents are given for longer than is necessary. F stands for find the right dose for the site and type of infection, as well as your patient status. Make sure the dose is right for their weight, their kidney, and liver function. U stands for understand the antimicrobial agent that you're using. Look up its mechanism of action, look up how it works, its efficacy data based on current evidence, its contraindications, potential side effects, and its pharmacokinetic and pharmacodynamic profile. This will help you understand how it's working to treat the infection, whether dosing will need to be adjusted if the patient's kidney or liver function changes, and what to potentially monitor for in terms of side effects. L stands for lose the duplicate coverage in most cases. This often happens when antimicrobial agents with overlapping spectrum of activity is ordered together. The most common example is double anaerobic coverage, such as when piperacillin and tazobactam as well as metronidazole is ordered together, or when you have carbapenem such as ertapenem and metronidazole ordered together. In most cases, we do not need the double coverage, so this regimen should be reassessed and the metronidazole can be dropped in most cases.